President and Chief Development Officer of SickKids Foundation. Thank you for joining us this afternoon for SickKids Ask Your Experts webinar series. It's a great pleasure to have you back once again with SickKids in our webinar in our August edition. And if it feels like we've been here before, it's because we have been. It was just 1 year ago, last August, that we talked about going back to school in the COVID era, and we never dreamt that in fact we'd be back here once again, needing to provide expert advice on the COVID-19 pandemic and how we can best support our children for best child health as they return to school. I'll be guiding our expert panel through a series of questions that we have developed, but please feel free to use the Q&A function to submit new or additional questions you may have. I will try my best to weave them into the discussion guidelines as we receive them. Additionally, we are pleased to offer a Mandarin translation today. If you would like to listen to this webcast in Mandarin, please use the interpretation option in your Zoom menu bar. And thank you very much to our interpreter for doing this for us. Now, today is a slight change to the program with apologies and with best wishes. Dr. Ronald Cohn, SickKids President and CEO, is not joining us off the top. He has a personal family medical emergency and is appropriately attending to that. So he will not be joining us, but we have our three esteemed colleagues to take us up through this next hour. Let me introduce them to you. Dr. Upton Allen is the head of the Division of Infectious Disease at SickKids, Senior Associate Scientist within our Research Institute. Upton is a past director of the Infectious Diseases Society of America and a fellow of that society. He's also a fellow of the American Academy of Pediatrics, fellow of the Royal College of Physicians and Surgeons of Canada, and fellow of the Royal College of Physicians of the United Kingdom. In 2018, Dr. Allen was awarded the Order of Ontario, which is the highest honor awarded by the province. Second, we have Dr. Jennifer Crosbie. Jennifer is a clinical psychologist and health clinician scientist within the Department of Psychiatry at SickKids. She's an associate scientist within the SickKids Research Institute and associate professor at the University of Toronto. Jennifer's research and clinical work are focused on understanding the neurobiological determinants of childhood neuropsychiatric disorders, with a particular focus on attention deficit hyperactivity disorder, as we know, ADHD. Third, Dr. Julia Orkin. Julia is a staff pediatrician at SickKids in the Division of Paediatric Medicine and associate scientist within our Research Institute. Julia is the medical officer for integrated community partnerships, where she supports system integration and partnership across the broad healthcare sector. Julia is a pediatric clinical lead for Ontario Health Toronto Region and the medical and fellowship director of the Complex Care Program and associate professor at the University of Toronto. So to Julia, to Jennifer, and to Upton, thank you very much for joining us today. And to all of our listeners and watchers, thank you for joining us today. So let me start off with getting right to the heart of the matter. Upton, I'm going to start with you. I noted that this is, if you will, return to school, the sequel. And we've learned a lot, though, over the past year and a half about living with the pandemic. And so we are hoping we can approach this transition with more calmly and more well-informed. And certainly today's webinar will be focused on what is the science, what is the evidence, ensuring that we have the evidence as much as possible guiding our decisions and showing you that and showcasing it indeed. So can you help take us through what we know now about COVID-19 and child health that we didn't know last year at this time? Upton, to you.
Well, Kevin, thank you so much for inviting me and my colleagues to join you today. Over the past year, we've had a better understanding of COVID, the disease, as well as the indirect consequences of COVID. And so with respect to the illness itself, we know that children, and we always knew this, but we have confirmation that children, while they do get ill with COVID, compared with
也会呢感染到新冠，那呢当然了，这是一定会的。那呢这个
ill, we know that can happen, but overall for children, while they can get ill, it still is a mild illness. The second thing that we've learned is that we need to not only focus on COVID, the illness, but also the various indirect consequences of COVID illness, as well as the things that we put in place to reduce the risk of transmission of COVID. And in that regard, one of the things that my colleagues will speak to some more is that we have a clear understanding that when one looks at risk of various strategies, what's coming out very clearly is that the indirect consequences of the things that we do are having a profound effect on the health and well-being of our children. And mental health is one of those conditions, for example.
Thank you, Upton. Indeed, let's actually turn to you, Julia, because we want to. You're speaking right to the heart of the issue here, Upton, and Julia, I want you to expand. What are some of the factors that we're considering as a hospital before advocating, in fact, for a safe return to class, and realizing that your guidance and assessment are for right now, things change by the week, it seems.
Thank you very much. And once again, thank you for having me. You're absolutely right. And that our goal as pediatricians and as child health advocates is really to ensure that the well-being of children and their families at the heart of everything that we do. And so recognizing risks and benefits in every decision. And so what we know now that we didn't necessarily know last year. So we know that there is a bundled measures of support that we can put into place that occur within the school setting as well as in the home setting. Those include making decisions around how you as a family go about your day, making sure that if you are unwell, following guidance to follow through with testing, stay home and isolate. In addition, within the school setting, to make sure that children and staff are wearing masks, maintaining physical distance, cohorting as required, and using other tools such as vaccination to ensure safety. Balancing that with the risks of not doing that, whether that's illness in a child or risks of mental health and others for not participating in school and or social endeavors that are so inherently important for our children and well-being. So we are in a position of known benefit of attendance to school and known mediating factors to modify the risk of infection to those who may be engaged in school or social activity.
Sorry, despite a year and a half getting off mute. Upton, turning back to you then, because it gives you a general setting, the question that comes up immediately is, but is it different this time around with the Delta variant? What can you comment in terms of the Delta variant and whether that changes anything for us in our assessment?
Well, I think the Delta variant is important. The big picture, though, is that when a year ago, when this all started, more than a year ago, we really didn't have a clear picture of what would evolve in terms of emerging variants of concern. We now have a clearer picture of that. With that, we've seen that in the case of the Delta variant, we have a variant that is more transmissible. So it's easier to be transmitted from one person to the next. It means that we have to pay close attention and in fact enhance the measures that Dr. Orkin alluded to facilitate a safe return to school. So we know that we can do that safely. That has been done in other jurisdictions. And so more easily transmissible, but we can certainly put mitigating strategies in place to reduce risk. The other point I should mention is that we also know that vaccines do work against Delta. And it also provides us with an opportunity to be reminded of what exactly vaccines are doing. In that, first, one wants to use a vaccine to prevent death. We want to use the vaccine to prevent severe disease, including admissions to hospitals, and then milder illnesses. And despite the emergence of the Delta variant, the vaccines are extremely effective in preventing severe disease and death. Yes, we may still have some cases of COVID occurring, but when they do occur, they tend to be milder. So I think it's really important for us to put that into perspective and continue to encourage people to be vaccinated to reduce the burden of COVID in the community, which will in turn facilitate a safer return of children to school.
Thank you, Upton. I think very important message, and I want to re-emphasize your key points here. Yes, Delta variant is more transmissible. More people will get COVID overall. That current vaccines do, in fact, we've shown protect against serious illness. They certainly protect against death. Are not perfect. So we still see people getting ill. We see people transmitting the disease, and that your core point is we are not seeing more incidents of COVID-19 in children than we were in the past. So that's an important point I think we'll want to come back to on and clarify on this for our audience. And I will come back to this and vaccines more generally. I think it's important right now though, to explore a little bit further with Jennifer, the points that both of you have alluded to, Julia and Upton, and that is the educational and mental health impacts of remote learning, not being physically in school, and the extensive restrictions we place upon our children and youth. We all have anecdotes that we can share in a way that reflect that we know it's not working so well. Can you tell us what the medical evidence is and tells us about the impact of the COVID-19 pandemic upon children and youth, Jennifer?
Absolutely. So, quite some time ago when the pandemic started, and I think none of us thought it would be this long, a number of us at SickKids in Toronto got together and we pulled together 4 large cohorts that were already exploring mental health outcomes in children and youth. And we, and in collaboration with many international partners, have spent the time over COVID really trying to explore the impact on children and youth. And I don't think any of us really thought it was going to go on for this long. And, Toronto and Ontario actually now hold the unlikely record for the longest lockdown. And we've spent some time really looking at the impacts of these public measures on kids. So being out of school, having restrictions on socialization, as well as virtual learning. And so we've had a chance to look at our data, but it's very much in line with the emerging data from our Canadian colleagues, but also internationally. And what it's showing overwhelmingly is that there has been a clear, measurable negative impact on children and youth for their mental health. And in fact, the data was quite striking even to us. Every time we go to look at it, we go back and we check because it's really very alarming. So I think as we go forward, we need to keep that in mind when we measure decisions that we're making around the risks and benefits. But to summarize briefly, we found that 70% of children, this was actually in the initial period of the pandemic, reported worsening mental health across a range of areas, including mood and anxiety and attention and irritability. More recently, when we looked again about a year into the pandemic, we found that 50% of children 8 to 12 were reporting clinically significant levels of difficulty with mood and anxiety. And when we looked at our adolescents, that number went up to 70%. So 70% of the kids who we were getting information about were reporting clinical levels of depression and anxiety. And worse, once those symptoms were elevated, they persisted. So we didn't, although the pandemic seemed to have a bit of ebbs and flows, that once children and youth got up into that elevated range, they've been persisting throughout. And so we're really very keenly attuned to the fact that there is real negative impact. Things like screens and social isolation, difficulties with virtual learning, all of these come up. We looked at different types of screen time, and there was a lot of screen time legitimately, but some of it was virtual learning, some of it was to fill time. And we really did find that it was clearly associated with higher rates of anxiety, depression, irritability, and inattention hyperactivity. So we're very keenly attuned to the fact that having kids stay at home and not being back in their recreational and their academic realms really is having quite an impact. And we don't know yet what will be required to kind of get back in there and help kids get back to normal. But as we make decisions about trying to enhance their development and keep them on course, we need to keep this in mind, that maintaining these very restrictive public health limitations does have an impact on them, and it really has dragged on for a long time at this point.
It's very helpful, Jennifer. Can you, we reflected on our commentary last year in the SickKids along with the other pediatric hospitals guidance on return to school, and it was all about assessing risk levels, the risk of staying at home, the risk of going to school. Can you talk a little bit further about the risk of a second year effectively at home versus the risk facing a child or adolescent of being in school, and how, even, I know you can't crystal ball gaze, so I'm not asking you to give that. I'm asking you to think, how are you weighing, imperfectly as it is, but weighing the risk on either side of the equation?
I have to say our data, and like I said, it's very consistent across the board, would say we have to do as safely as possible, get kids back engaged with each other in recreational activities, be it sports or other kinds of elements. Not being involved in those is having a significant impact on them. So we would advocate clearly in whatever is the safest way possible to have kids as engaged with each other as much as possible, and to do so actually socially. Some virtual social interactions are fine, but what our data shows is it was not enough to prevent kids from really ending up in a precarious situation when it came to their mental health and their development. So as we weigh those pros and cons, we really need to kind of keep that in mind. And our recommendations of us, and contributing to the statements by the hospital and the pediatric associations right across Canada, has been very much advocating to increase those social interactions for kids in a safe way, but most definitely to increase those, and really saying that we know that what the negative outcomes are from not doing that from a social interaction perspective.
We're looking, of course, at a mental health standpoint, by the time you add up the mental health risks that you're assessing, the educational attainment issues, which we aren't commenting extensively on, as not as an educational institution, that or at least a primary, secondary educational institution. There are risks on both sides. So our current guidance remains that right now, given what we know, the risks of attending school in person are outweighed by the risk of remote learning and the challenges and lack of social interaction. Good. Thank you, it's helpful. Now, this comes, I'll go back, it may seem odd, but there's a reason for this. I want to go back to the vaccine issues and Dr. Allen, because whether we have some questions coming through already about, well, what about Delta variant, what about vaccines, and perhaps a little bit more expansion around what having such a significant portion of the adult or 12 plus population vaccinated or double vaccinated plays in terms of mitigating the risk of in-person learning, and what insight you can give to us about the benefit or the risk mitigation in place by existing vaccines. And then I'm going to ask you a follow-up questions about future vaccines.
Okay, thank you. In trying to reduce the risk of COVID illness among children, generally we think of two main strategies as far as vaccines are concerned. Number one is to create around them what we refer to as a protective cocoon or ring vaccination. In other words, we create a barrier, a safety barrier around them, and that essentially means vaccinating family members and the community at large, so that the vulnerable population of children are protected. The second strategy then is to vaccinate those children who can be vaccinated. At this point in time, we're talking about those who are, turning 12 and above. But we're still left with a younger population who yet cannot be vaccinated. And for those, the emphasis is on ensuring that there's that protective cocoon around them in the community, at home, and also within the school environment, all part of that package that Dr. Orkin alluded to earlier, that bundle of measures to create a safe environment for the children to return to school. And vaccines have an important role to play as part of that bundle of measures.
And can you elaborate more on the timelines or the processes in place now to explore the ability to administer vaccines to 12 and under? What we know from the science and from the trials ongoing, and what's a reasonable conservative timeline to look at when that might be a possible strategy?
Well, thank you. As you know, when vaccines are developed, the studies are done among adults first, and then children after. And we recognize and always say as pediatricians that children are not small adults. And so we need to ensure that the pediatric research is done. That children are included in the vaccine trials with the right pediatric doses. Now, for somebody who is 12 and above, the immune systems are close enough to adults compared with a younger child. And that's why, you know, you want to get as much data for the youngest group before you start to vaccinate that, you know, under 12, under 11 now. And so the vaccine trials targeting the young group, you know, the folks younger than 11 or 12, those trials are being done. We're told that we should have data anytime over the next month or so. And we're looking at a possibility that vaccine might become available mid to late fall, at least in North America. So we're not there yet. Work is being done, but it's really out of ensuring that we proceed with as much caution as possible to ensure that vaccines are safely administered to children based on their age groups and how their immune systems will respond to those vaccines, and that we put in place surveillance mechanisms to detect any safety signals that might develop, recognizing that those safety signals, for the most part, are rare, but they can certainly be detected with the systems that we have put in place. But a key take-home point from what I'm saying is that we need to remember the protective cocoon around these children, vaccinating family members, the community at large, and individuals working within the school space to create that protective environment around children, many of whom can't be vaccinated yet because of age.
Thank you, Upton. I want to proceed it, and please, Jennifer, Julia, jump in if we need to. We're getting some questions, and I think it's really important to slow down and make sure we're clear on this. The concern is children under 12 right now can't have vaccines. Delta variant is more transmissible. Do we have to worry about some explosion of COVID-19 infections in the 12 and under group? I'm careful here, I'm not putting words in your mouth. I want to make sure I understand you correctly for our audience. The strategy you're articulating is to put a protective cocoon of vaccinated individuals 12 and over around those who can't get vaccinated, 12 and under, and that is a first frontline strategy for minimizing infections in the 12 and under children.
That is an important one of the frontline strategies that's really important, but there are the other public health measures that we have to be aware of and follow public health guidance in that regard. We should also recognize, Kevin, that over the next month or two, we are going to see us enter the respiratory virus season. That happens every year.
Yes.
What it means is that we would expect to see more coughs and colds. And honestly, we're going to see more cases of COVID. But what we want to do is to have those public health measures in place and vaccine strategies in place to reduce those numbers, keep them to a manageable number of cases that are occurring.
Thank you. There's one other. I'll come back to it later on if we don't address it. I do want to turn to Julia and follow up on this point in terms of becoming very practical. You alluded to the bundle before, Julia, and let's just take a second and dissect that bundle. Bring it back down to individual families and their children, what they have in their control, and what we can do to help our children safely return to class. What role can we take? What can we do in these next few weeks to help them physically return in a safe manner to class?
Thank you. I think that's exactly right. To recognize that each one of us is a part of a greater community, and that we have individuals in the community who are unvaccinated, whether due to age or other reasons. The number one thing that we can do is be mindful around our decisions. So if our decisions support a safe community and minimizing risk of infection and spread. The risk with Delta, as you heard from Dr. Allen, is that it's extremely infectious. When things are infectious, the more close contact, the sharing, indoor spaces, the lack of physical distancing or mask wearing, the more likely it is that that disease will spread. And so what we need to do is be extremely vigilant around our decisions and our process. And in addition, vaccinated individuals are still able to potentially spread illness and COVID-19, which is important. Just because you have a vaccine does not mean you can remove all of those public health measures that we've talked about. So making decisions, and once again, weighing the risk and benefit of each decision in terms of what is a benefit to our society. So for example, if my child wakes up with a bit of a runny nose, instead of just saying, oh, it's just a runny nose, I'm going to send them to camp, I'm going to say, no, we're going to go and have a COVID-19 test. We're going to stay at home until we have the results. We're going to wait until they're asymptomatic to return to their environment, whether that's school or otherwise. And so once again, being as vigilant and thorough as possible will allow us to get to a place of safety and hopefully, allow the fourth wave to come and then go without having significant consequence of hospitalizations or significant illness amongst our community.
So can you, mask wearing, hand washing, maintain physical distance, those messages just don't change. And I hear you all saying maintain those three key fundamental points in place now. This is not the time to relax those measures. So help us understand a little bit more, if you can, on gym time at school and how is it safe to be in gym class? Lunchtime, taking off your mask in a classroom, 30 kids in a classroom, there is no change to that. There are 30 kids in a standard classroom. Physical distancing is limited. Ventilation changes are limited. So what is our best guidance to parents to help coach their children in those situations?
So I think there's a few things around school and school safety. So the first around school safety is ensuring that everyone who is within the school is healthy. So that goes back to even before the decision of what happens around masking, physical distancing, cohorting, et cetera, is that if you are doing active screening of yourself and your family, that you are not sending your individual to school or into any workplace with any symptoms whatsoever. That is the number one. And then those who do have symptoms, that they have access to quick testing opportunity. So for example, in the Toronto region, through multiple hospital partners and Toronto Public Health, we will be supporting take-home testing across all schools. And so what that is that at school, an individual who either fails the school screener or who unfortunately becomes unwell or meets a symptom associated with COVID-19 at school could be sent home with a saliva kit. And what that would mean is that we have increased uptake for testing. We can know quicker, and the family can know quicker that that individual is not positive for COVID-19. They can then get better and return to school as fast as possible. Once again, keeping that school community as healthy as possible and maximizing that educational and social impact. In addition, what we know is that within the classroom, wearing your mask, but having appropriate times for mask breaks or physical distancing outside is essential, but doing it in a safe way. So that is often looking at the numbers of people involved and the risk benefit of each activity. And so we are going to need to remind each other around, don't forget to wash your hands, the hand sanitizers outside before you come into the classroom. Teaching our children and monitoring and modeling that behavior now in preparation for back to school is essential. And really hoping and really recognizing that our school is a representation of our entire community. So when there's high transmission within the community, often that can trickle into school. And it's not that school in and of itself is a breeding ground for infection. It's that schools and children and families are part of larger communities. So big gatherings, limiting contact that could be potentially in risky indoor dining with small groups of families, that really is not recommended at this point in time, especially when there's unvaccinated individuals.
Well, thank you. Just going to say that we're going to ask this group about, and please feel free, Jennifer or Upton, to join in. But Julia, the question has come up. What about my out of school play dates? Seeing children not from your, if you will, your school cohort, but mixing with children from other schools. Even other family members that are attending other schools, effectively crossing the bubbles, the big bubbles. Is there any recommendation or guidance on that?
I think the first number one guidance is really similar. So if you're unable to maintain physical distance, you're going to be in close contact, even outside, then you wear a mask, you provide good hand hygiene, you make sure that everyone's healthy and well. You don't put yourself in situations that are going to breed the desire to all sit close on a picnic table and share cake, for example. You're making decisions that are as best informed as you can and as safe as possible with the information that you know. And once again, it's back to that same bundle of safety. What can we do on a day-to-day basis that minimizes our infectious risk, that maximizes our social engagement, allows for growth and well-being for our children, at the same time as recognizing that we do not want, as we go into the back to school season, to risk what we know is so important, which is educational attainment.
Okay, thank you. Well, thanks for allowing me to explore that a little bit further. To the group, I don't want to get into specific patient situations, but somebody asked, does the general rule still apply that we would have had last year, that if a parent has a child with in any way has a compromised immune system or compromised health condition, if a child is cancer, other treatment or recovery, has a sort of like the Duchenne muscular dystrophy or other condition, that we need to just continue to follow the same protocols and maintain the practices they've been practicing for these past months, keeping them appropriately masked, hand washing, physically distanced, but still allowing interaction that's so important for the other parts of their health. Julia, yes?
Yes, I can answer. What we do know is that individuals with chronic disease are at higher risk for any viral illness, COVID-19 not, alone. So whether that's influenza, common cold, we know that the importance of these measures actually are across the board. So if a child has asthma, for example, it is extremely important that their asthma is as well controlled as possible and they're seeking health guidance. And that remembering that, once again, it is the same bundled measure, but that the consequence potentially is there for a more severe presentation or risk of hospitalization, making the importance of following public health measures and or vaccination important.
Great, thank you. Jennifer, can I turn back to you? I want to go back to the mental health, and if there's a theme here, it's balancing, all the time balancing. We say, okay, right now, I'm hearing you. I'm convinced I can do this safely. My child can return to school safely. Give us some tips. Give our parents and their caregivers of children or teens tips on coaching their kids on re-socializing. Yes, I think there's been more activity this summer, but you're about to go back into class. What do we have to think about as we help our kids reintegrate into a physical in-class setting?
Well, I think that the summer has helped. We've been in a period where kids could play outside. Hopefully kids have gotten outside, been able to interact with, other kids do things, even if it wasn't informal activities. So I think that provides us with a grounding to kind of reintegrate back into school. We always recommend for, you get some kids might be a little bit nervous about just the fact that they've been out, they've been, maybe feel like they're a bit behind. So reminding kids that everyone's in the same boat, that everyone's been out and been doing virtual learning, remind them that we know that virtual learning was hard for everybody. So they might feel like it was hard for them, but everybody else seemed to be doing fine. I think reminding them that everyone's in the same boat and the teachers are aware of this, school are aware of this, and parents are aware of this. So that's one thing to remind them. Another thing is it's always control what you can control. So, we've talked a lot about what individuals can do to keep them safe, but how what they do for themselves is helpful for everyone else. So saying that to kids, reminder to them, it's important to wear your mask and wash your hands. Everyone else is going to do that. So you worry about you. Have you washed your hands? Have you used sanitizer? Are you wearing your mask? So rather than worrying about what other people are doing, you just do what you're supposed to do to be responsible when it comes to COVID kinds of restrictions, but then also to kind of go back into school with a positive attitude and to remember that everyone's in the same boat and that you take it one day at a time, and also, be aware of the fact that there's lots of excellent adults and experts like us, like their parents, like everyone who's monitoring the situation and making good decisions to help everyone move forward in a positive way. So they don't need to worry about those decisions that are being made. There's great experts who are doing that for them and consulting and really keeping an eye on everything. So the key advice is do what you can do for yourself. What can you control for you? Keep in mind that everyone's sort of in the same boat when it comes to being out of school for so long, and that everyone probably feels a little bit excited and maybe a little bit nervous, but that's okay. Everyone's going to get back into this next phase of life and figure out how to move forward in a positive way.
So supplementary question, Jennifer, and pushing you a little bit on this. So what are the bottom line? What are the risks of choosing to not have your child go back to an in-classroom setting?
Yeah, I think what we've seen from the data is that there is real risks, that there is, the kids are experiencing, children and adolescents are really experiencing this in a negative way. There is clear impacts on their mental health, their physical health, their social development, and their academic development. So I think, of course, there are situations where families need to make those choices, but I think in a situation where they can be safe and are following guidelines, and there's not another family circumstance or individual circumstance that puts them at unique risk, I would say that there are real risks in not having kids being able to interact and socialize in safe ways and to be back into an in-person learning environment. So for families to keep that in mind as they go back in. Again, it's also not just families, and I'm sure not just kids, and I'm sure this will resonate with parents, but there's real impacts on families and family units as well. Our data has really shown the stress on families and family interactions and processing and parents and kids. That's also taking its toll over time. So really together making good choices to get your kids back into a social environment where they can be active and interacting with other kids and other adults and teachers, and will also have a really positive impact, I think, on families and parents, which overall will improve the health and mental health of the family unit as a whole.
Thank you. Thank you very much. I'm still getting some questions on, I'll say, the impressions being created by media right now, especially media out of the United States. So without commenting on the American experience in pandemic, the images that we're seeing are of a number of children ending up in the ICU. Can we speak a little bit more about the areas, but what about that risk that we're seeing in the US? Can we comment about that risk and what we know about that risk, and perhaps why it's a different situation in Canada? Upton?
Yeah, I can comment. It's important to recognize, as I said earlier, that children, although the disease is mostly mild, some children can get more severe illness and end up in hospital. Some can even die. We know that. The larger the numbers of individuals who are infected, the greater the chances that you'll see some kids who end up in the ICU or even worse. With that in mind, it's important to learn from lessons elsewhere, for sure, in terms of in the United States and elsewhere. But at the same time, we know what we need to do, what we should do to reduce the risk of transmission within the Canadian context. The importance of vaccination, that cocoon effect that I mentioned earlier, the importance of public health, all of those are measures we need to put in place to ensure that we do not end up in a place that looks like some of the reports we see coming out of parts of the United States.
Yeah. And so, a follow-up question to you, Upton, then I presume it comes back to vaccinate. You have been the voice in so many ways of countering vaccine hesitancy. I want to give you a chance to speak about or speak to those who are still hesitant about getting vaccines and what your core message is today.
You know, we really do understand.
其实呢，我完全理解，有一些人呢，有很多呢原因，有一些有很多原因跟
have coming to them from various sources. Let me just focus on one. And we all, including all of us on the webinar today, have been told that these vaccines were developed very quickly. And that's true, but we need to qualify that. And in that regard, Kevin, the notion that a vaccine or vaccines for COVID-19 were developed from ground zero to where we are now within a year, it makes absolutely no sense. It's not true. And the reason for that is that in 2002, 2004, we had SARS-1. And shortly after that, the vaccine work started directed at SARS-1, and SARS-1 disappeared. But guess what, Kevin? SARS-1 is about 80% identical to the COVID virus. In addition to that, we had the Middle East respiratory syndrome virus, which is a cousin of the COVID virus. So when COVID came along, 2009, 2020, we had 10 to 15 years of work already done to help to facilitate the development of the COVID vaccines. Coupled with that, we had many years of work on mRNA vaccines in cancer to be able to facilitate that. So another way to look at this in terms of the timeline to the development of the vaccines, the COVID vaccines, is that if COVID had happened in 2002, 2004, we would take 10 to 15 years, perhaps, to develop a vaccine. It would be a long time, maybe not long, but a long time. And so we're fortunate in a way that we had the many years of work that had been done previously. So yes, the vaccines were developed quickly, but they were based on years of fundamental work that facilitated their development. So I hope that helps to explain this whole notion that, well, gee, these vaccines were developed very safe, very quickly, and therefore maybe the safety has been compromised. Safety has not been compromised.
Thank you. Very important message. I know Julia or Jennifer, do you have anything? Because this question, I'm concluding from all three of you that this is not magic. This is get vaccinated. They're safe and in development for almost 20 years. Keep your physical distance. It's not time to be running out and being inches away from everyone else. Wear a mask, wash your hands, and but do interact. And those are the messages you're delivering here. This interactivity is really important, whether you're adults or whether you're children. Is there any and I guess any way to convince or help our children and teens look at some of the other benefits of maintaining these measures? Are there, we can look at the carrot or the stick approach. If we do these things, we'll be able to do the following things, or you can have access to the following things again. I guess, is it team sports? Is it being able to have music class once again in school? If we're careful, is actually going to school if we're careful? What do you recommend in terms of providing the positive spin, not always the negative, not always the worry or fear? Jennifer.
I mean, one of the things that I'll say is that, after such a long period of such intense restrictions, particularly for the kids and the adolescents being out of school, I think an environment where we decide to prioritize going back into school with safety measures already is providing them with something. So kind of having them acknowledge, okay, so we've decided, or we've determined the best way for kids to go back to school and to learn in person, to really kind of take advantage of the elements that have been decided as being safe, but keeping those safety precautions in place. So it's a little bit of, after this long period of being completely out and really across the board, I think all of us anecdotally, but many of pretty much all of the youth and kids who I talk to, really at the end were experiencing it as highly aversive. So to be back in school, but to acknowledge that there are things in place that you must abide by to keep everyone safe, but also so that we can maintain this level of compromise in having kids back in school and having some activities that we can do if we keep these safety precautions in place. So really appealing to that idea that we have to keep these in place to keep everyone safe. And we have these things that we can do and do it in a safe way. And this is a significant improvement over the periods of time where we were under such extreme restrictions.
Very helpful. Julia, this is a fair question for you. It's coming through in terms of our own readiness, SickKids readiness. If we are concerned that there could be more children presenting with more severe cases of COVID-19, can we help people understand what we as SickKids have learned in terms of how we manage a more severe case, and that we provide the assurance that A, our ICU is ready, heaven forbid we need to, and B, we're better prepared to actually manage the disease as we have other diseases over history.
Yes, absolutely. So I think I'll start by saying, yes, the news is showing quite significant concerns across the US, but right now, as of today, there is no COVID-19 pediatric patients admitted to our hospital as the number one. So we are not seeing an incredible surge right now of patients. We are seeing common cold and flu, and there's a little bit of a cold going around, but that is not equating to significant hospitalization. We are not under pressure. And we are currently absolutely fine from a hospital function perspective. In addition, one thing that we have learned in the last year is we partner incredibly well with our community. So we have not just SickKids, but community hospitals that have access to support for pediatric and adult patients just the same. And by integrating as a healthcare system, that we can ensure adequate access for individuals who require care. And so I think what we are doing right now is we are preparing and thinking. We are creating surge plans in case. We are upskilling and educating across the board. We are preparing with our other children's hospitals around what would be required in case one geographical region was harder hit than another if required. And all those plans are in play and have been actually in play for many, many months, thankfully not had to use them. What we had done in the past is supported our community hospitals to better care for adult patients by supporting the additional community patients here at SickKids by creating capacity. And so I think what we do know is that we can work collaboratively and we will be absolutely able to care for any and every patient as required, and that we're not canceling any of our routine or preventative care on top of that. So we are by no means in a crisis mode, and we are continuing all our routine care and operations, and are hopeful once again that some of the discussions you've heard here today will allow us to continue to do so.
Great, thank you. It's really positive and reassuring message for everyone to hear and to understand that we are much more ready this time around and prepared and have learned. The system is learning, the system is functioning. I think it's wonderful reassurance. I want to sort of give you good opportunity, each of the three of you, to really summarize the sort of your parting comments and what are the key takeaway messages you want our audience to have, and the actions they can take as they prepare for this this next few weeks.
Sure, I can start. Yeah.
Thank you.
I think the number one thing is to, to take each and every opportunity to support yourself and your community. So by considering COVID-19 vaccination, if you have not received it, or seeking out information and understanding and guidance to make sure that you have all the information to make an informed choice, whether that be to go forward or not, to see each and every opportunity that you engage in as a mechanism for safety or potential spread. And that as we go forward, I think each and every healthcare provider, whether that's your family physician or public health or other resources that you seek out, are really there to support you and answer your questions. I've had the opportunity to see some of your incredible questions, and I know we haven't gotten to all of them, but I think once again, please seek out answers to your questions to make informed choices for you and your family.
Thank you, Julia. Upton, do you want to go next?
Sure. I think that's, I'll make a few points. Really important to remember the concept of the protective cocoon or ring vaccination to protect our children. That's so important. Many of these children, certainly the younger ones at the current time, cannot be vaccinated. Plus, you've also heard the children who have weakened immune systems and or compromised organ systems that might make them unable to optimally respond to the vaccines or at risk of having bad outcomes from COVID. So that protective cocoon is extremely important. It's also, second, it's also important to recognize that when one takes vaccines, it's a risk versus benefit scenario. And there's no question that the benefits far outweigh risks. Those benefits include getting kids back to school in a safe manner. The vaccines are associated with very rare side effects, which are detected by a system that is working. In other words, one puts in place a surveillance system or a signal detection system. And essentially what it is, it's a signal detection system to pick up rare events. And so when those rare events are detected, if they are, it should not discourage us. It tells us that the system is working. It helps us to identify things that we need to have a closer look at to try to prevent from happening among people who are vaccinated.
Thank you. It's actually a very important point where we're talking about adult health or child health. There's certainly been two very, very specific instances of concerns, and your point would be that the fact that we know and the fact that we're addressing and taking action to course correct is exactly the way the system is supposed to work, and it actually shows safety is being monitored and taken very seriously. Up until hopefully great assurance of those listening that the system in fact is working and the vaccines in fact are safe and effective. Jennifer, I want to turn to you then for your, what are your key takeaways for our audience today?
So my key takeaway is really sort of accepting what's in place from a safety perspective and what's being asked and required. I think after we put those in place, we really need to get kids back into as close as possible into activities of childhood. It's vital for their mental health and their development and their social health. And it's actually vital for families and parents and adults in their world as well. So I think as much as possible, while abiding by what's being put in place to keep them safe, we really need to get kids engaged in school and recreation in safe ways, and really keep that as a priority and keep the pressure on as a priority, because without doing that, there really is going to be other secondary negative impacts, which we've already started to see. So keeping a focus on maintaining what we know is necessary for safety, but also helping kids to move forward with their development and their social and mental health.
Thank you. Thanks, Jennifer. So to Jennifer, Julia, Upton, thank you very much for giving us your hour this afternoon, giving us your thoughtful, reflective advice and guidance, basing everything on evidence and allowing our audience, supporters of SickKids, to hear from you directly, to benefit from the best information that you have at your fingertips to help them, parents and caregivers, make informed decisions that support the safety of children and youth throughout the GTA and help them with their mental, physical health and their educational attainment. So thank you very much for supporting today's webinar. To all of those listening, watching us, thank you for joining us. Thank you for support of the Hospital for Sick Children, SickKids. We could not do what we do without your philanthropic support. We're very grateful. We hope that this occurrence in our series of Ask Our Experts shows you our gratitude and shares with you the impact that you're achieving through SickKids. We will be back in October, 2 months from now, with our next webinar. Please watch for our date and time and topic in your email. We've got some great thoughts. We'll be responsive, though, to our environment. So wait until September to hear from us on what the exact topic and timing is going to be. So to everyone, Jennifer, Julia, Upton, thank you very much for your time. To those listening, thank you. Stay safe and have a safe return to school for our kids. Have a good evening, all.